going to be speaking to you a little bit about lupus, specifically systemic lupus erythematosus. Millions live with SLE, yet it's one of the most misunderstood autoimmune diseases today. Today, we are going to go beyond the basics of what lupus is and uncover what's really happening inside the body, the science, triggers, and the cutting-edge ways researchers are trying to outsmart lupus. Now, lupus, as I mentioned, is an autoimmune disease, which means that the immune system mistakes the body's own tissues for enemies. But lupus isn't just one disease, it's a syndrome, with different patients showing very different symptoms. Some patients will come into clinic having only skin involvement, others joint pain, while in severe cases, lupus inflames the kidneys, heart, or even the brain. And this is why it's called the great imitator, because SLE can look like many different chronic conditions like arthritis, chronic fatigue, kidney disease, or even infections. So why does this happen? In lupus, the immune system loses tolerance, which means essentially the ability to tell self from non-self. So the ability to tell self cells. So the concept of self versus non-self is that all our cells in our body have antigens that are specific to ourselves, and that the body can the body essentially knows whether a cell is ours or is from a foreign pathogen or any other cell that is coming from the outside, or a cancer cell. So essentially this is how the body knows whether to destroy a cell or not. And so with lupus, this tolerance it loses this ability. And so the three main kind of processes that take place is that firstly, B cells, which is the cells that normally produce antibodies against viruses, start making autoantibodies. And these autoantibodies essentially, they target DNA, proteins, and cell fragments. And these autoantibodies will clump together with their targets of DNA, proteins, and cell fragments, which are found around the body, and form immune complexes. And when these immune complexes get stuck in blood vessels and organs, this can essentially create a target for our immune system to attack, which will trigger inflammation. And the complement system becomes quite active in this process, and it will join in the attack, making the inflammation worse. And so this cascade of events is what we know of as the typical symptoms of lupus, of joint inflammation, and the different organs that will be inflamed, and the different symptoms that patients will experience. But lupus isn't just any autoimmune disease. It has unique features that we're able to test on typical labs. So many patients will show ANA positive, which stands for anti-nuclear antibodies, meaning that their immune system attacks the cell's own nucleus, which you can see from the name, anti-nuclear. And then another lab that is commonly ordered is dsDNA and SM proteins. So dsDNA stands for double-stranded DNA, and SM stands for Smith proteins, and these are highly specific for lupus. However, not all lupus patients will also develop these. And there is also evidence that in lupus, the body doesn't clear dead cells properly. And so this creates lingering cell fragments, which act as a constant alarm signal, keeping the immune system on high alert. And which is why we find these autoantibodies that are more prone to attacking the nucleus and double-stranded DNA and these cell fragments that are floating in our cells, essentially. So who gets lupus and why? So, firstly, lupus is about 9 times more common in women than men, and researchers think that estrogen and other hormones influence how the immune system behaves, and is in large part why a big reason why people develop lupus and it persists. Genetics matters as well. So, lupus often runs in families, especially where other autoimmune conditions are present. So, you will find that many people with lupus have other autoimmune conditions at the same time. Environment also plays a big role. So, things like sunlight, infections, stress, and even certain medications can trigger lupus flares. So it's not really just one cause, but a perfect storm of genes, hormones, and environment that allows lupus to be, that allows for the onset of lupus and the persistence of the disease. So lupus diagnosis is tricky because there's not one single test that's enough. Doctors will look at a combination of symptoms, lab tests, and clinical history. So, in terms of blood tests, this will include ANA test, which is sensitive but not specific. So, many people without lupus can test positive. And another blood test, series of blood tests will be the anti-dsDNA and anti-Smith antibodies, which are more specific to lupus, but they're not always present. And then lastly, the complement levels of C3 and C4, which are often low during active lupus flares. Sometimes markers of organ involvement will also be ordered, like protein, which can be kind of determined through protein in the urine for kidney damage. And so, as you can see, there's not one specific test to be able to conclusively diagnose lupus. It's a combination of taking a good clinical assessment, and also running various lab panels. So this actually is what makes lupus one of the most complex autoimmune diseases to pin down, and why it sometimes takes years for patients to get a clear answer. So there's no specific cure for lupus yet, but treatments aim to calm the immune system and prevent organ damage. And these can include treatment modalities like antimalarials, like hydroxychloroquine, which reduces flares and inflammation, corticosteroids, which are powerful but with side effects if used long term, immunosuppressants for the general dampening of the immune system, especially when there's organ involvement, and newer biologic drugs like belimumab, which targets specific immune signals such as BAFF, which stands for B cell activating factor, and it is a growth factor for B cells. So the goal with lupus overall, especially when your doctor is creating a treatment plan, is to control, balance, and prevent damage rather than turning off the immune system completely, which would be impossible because you would then be susceptible to infections. So here's where things get sort of exciting. Scientists are using various methods in order to outsmart lupus and further understand its pathogenesis and how the disease manifests. And this is done through a series of different sort of methods, one being immune repertoire sequencing, which is to track which B and T cell clones expand during flares, as well as exploring interferon signatures, which we know are unique patterns of immune activation that can predict disease activity in lupus. Another clever sort of method that researchers have come up with is investigating cell-free DNA and other blood markers for non-invasive monitoring, and even applying AI and machine learning to detect hidden patterns in lab results, which can help doctors predict flares before they happen. So the future of lupus care is definitely moving towards personalized medicine and tailoring treatments to each patient's immune profile. Lupus is more than a medical condition. It's a puzzle at the intersection of genetics, environment, and immunity. And while it remains unpredictable, every year scientists bring us closer to understanding its signals. With better diagnostics, smarter drugs, and AI-driven insights, we're not just learning what lupus is, we're finding new ways to outsmart it. If you found this video informative, please give it a thumbs up, subscribe, and let me know in the comments what aspects of lupus or autoimmunity you'd like to explore next.